Good evening, and welcome to the latest installment of the OSU College of Nursing Policy Hour. Today, we will review the executive order issued by the President of the United States on Thursday, October 12th, and its expected impact. First, let's review the executive order. After repeated failed attempts by Congress to repeal and replace the Affordable Care Act, the President has decided to take matters into his own hands. Via Twitter on October 10, 2017, he states, "Since Congress can't get its act together on health care, I will be using the power of the pen to give great health care to many people fast." The executive order states it shall be the policy of the executive branch to facilitate the purchase of insurance across state lines, and it prioritizes three areas for improvement. One being expanding access to association health plans, allowing small businesses to band together to purchase large group insurance. The second, extending the availability of short-term, limited-duration insurance. And finally, expansion of health reimbursement arrangements. So what does this mean? According to the Morgan Planning Group, association health plans already exist in the marketplace as a way for businesses to pool together for better buying power. The Affordable Care Act placed regulations on these plans, requiring them to provide essential benefits. The executive order could allow association health plans to avoid certain ACA requirements. The executive order instructs departments to allow common geography to be a factor in formation across state lines in an effort to drive costs down. However, insurance companies aren't mandated to participate in this, and they state that consumers aren't interested in plans that can move from state to state. Under the Affordable Care Act, the duration of short-term plans was capped at less than 90 days. The executive order seeks to expand the covered time period and allow for renewal. The executive order also seeks expansion of the healthcare reimbursement arrangements, which are employer-paid benefits that reimburse the employee for medical expenses. What happens now? The executive order directs certain departments to revise rules and regulations. They have 60 days to draft new regulations for the association health plans and short-term insurance, so we should see something by December 11th. They have 120 days to change health reimbursement arrangements, taking us into February of 2018. On the same day the executive order was signed, the administration announced it was ending cost sharing reduction, or CSR, payments. These payments help subsidize the cost of health insurance for low-income Americans. Several provider organizations spoke out against the executive order and the end to CSR payments. The American Nurses Association President Pamela Cipriano issued a statement saying the executive order sabotages Americans' health care and that patients could be sold plans that don't cover essential health services like contraception or mental health care. It could also leave those with pre-existing conditions unable to afford health care coverage. The American Medical Association President David Barbie stated that our patients will pay the ultimate price with the decision to end the CSR payments. And the American Hospital Association Executive VP also weighed in with similar sentiments. The Senate Health, Education, Labor, and Pensions Committee was working on a bipartisan effort to stabilize the ACA market and lower premiums for those buying on the exchanges. Those efforts stalled as the GOP began to renew their efforts to repeal the ACA. Healthcare groups are pushing for a renewed focus on these efforts and requesting continued CSR funding until stabilization is reached. On a supportive note, the National Federation of Independent Businesses, which is the small business lobby, they were grateful for the executive order that addressed regulations they feel make it costly to provide employees health care, stating the cost of health care has been the #1 problem for small businesses for over 30 years. Consequences for consumers and insurers need to be understood. There is a potential that healthier, low-cost groups could create an association health plan, leaving traditional plans to cover the sicker individuals, driving up those premiums. In terms of eliminating the CSR, the Congressional Budget Office estimates if CSR payments end in 2018, premiums would rise 25% by 2020. The CBO projected that ending CSR would raise the deficit by $194 billion through 2026, making it more expensive to end the payments than to keep them. There really is no way to know the impact the executive order will have until we see what rules and regulations are put into place. When will Congress come together to solve the healthcare crisis? How many more executive orders can we expect to see? There is nothing but uncertainty ahead. Please continue to communicate your wishes to your congressman. Be an active participant in the democratic process. This is Vanessa Jameson reporting. Have a good evening.